Discuss the role of dopamine dysregulation in schizophrenia. How does this understanding influence treatment options? Answer: dopamine dysregulation plays a central role in the pathophysiology of schizophrenia, a complex disorder characterized by a range of symptoms including hallucinations, delusions, and cognitive impairments. The dopamine hypothesis suggests that an overactivity of dopamine transmission in the mesolimbic pathway contributes to positive symptoms such as delusions and hallucinations. In contrast, hypoactivity in the mesocortical pathway is implicated in the negative symptoms of schizophrenia, including social withdrawal, anhedonia, and cognitive deficits. The treatment of schizophrenia has been primarily focused on antipsychotic medications that antagonize dopamine D receptors, effectively reducing positive symptoms. However, this treatment paradigm has evolved, recognizing that schizophrenia involves additional neurotransmitter systems, including glutamate and serotonin. The emerging understanding of the interplay between these systems has led to the development of atypical antipsychotics that not only target dopamine but also modulate serotonin receptors, which may help alleviate both positive and negative symptoms. Furthermore, the recognition of the heterogeneity of schizophrenia has prompted personalized approaches to treatment where clinicians assess individual symptoms and responses to medication. This may include adjunctive treatments such as cognitive behavioral therapy (CBT) or novel pharmacological agents like glutamatergic modulators, which can target cognitive deficits associated with the disorder. Relevant guidelines: the American Psychiatric Association (APA) recommends a comprehensive assessment of symptoms to guide treatment selection, emphasizing the importance of monitoring treatment efficacy and tolerability through ongoing evaluation and adjustments. In what ways do cognitive distortions contribute to the persistence of major depressive disorder (MDD), and what cognitive behavioral strategies can be employed to address these distortions? Answer: cognitive distortions significantly contribute to the development and persistence of major depressive disorder (MDD). These distortions involve biased thinking patterns that negatively skew an individual's perception of reality. Common cognitive distortions in MDD include all-or-nothing thinking, where individuals view situations in black and white terms, and catastrophizing, which involves predicting disastrous outcomes, and personalization, where one takes excessive responsibility for events outside their control. These maladaptive thought patterns exacerbate feelings of worthlessness and hopelessness, leading to a self-reinforcing cycle of depression. For instance, when faced with setbacks, an individual may engage in all-or-nothing thinking, interpreting any failure as proof of their inadequacy, thus deepening depressive symptoms. Cognitive behavioral therapy (CBT) is an effective treatment modality for addressing these cognitive distortions. CBT involves several key strategies. Cognitive restructuring. Patients learn to identify and challenge their negative thoughts, replacing them with more balanced, rational perspectives. Behavioral activation. Encouraging patients to engage in activities that promote positive emotions and reinforce a sense of accomplishment. Skills training. Teaching problem-solving skills and coping mechanisms to manage stressors more effectively. Research shows that CBT can significantly reduce symptoms of MDD, improve overall functioning, and lower relapse rates compared to treatment as usual. Relevant guidelines. The National Institute for Health and Care Excellence (NICE) recommends CBT as a first-line intervention for moderate to severe depression, highlighting its efficacy in modifying cognitive patterns and enhancing resilience. Describe the significance of the biopsychosocial model in understanding substance use disorders. SUD. How does this model inform treatment approaches? Answer: the biopsychosocial model is crucial for understanding substance use disorders, SUDs, as it emphasizes that these disorders arise from a complex interplay of biological, psychological, and social factors. Biological factors: genetic predispositions can increase susceptibility to addiction. Neurobiological mechanisms, such as alterations in dopamine pathways, are central to the reward circuitry, influencing cravings and reinforcing substance use behaviors. Psychological factors: co-occurring mental health disorders, such as anxiety and depression, often exacerbate substance use. Cognitive distortions, poor coping skills, and personality traits can also contribute to the likelihood of developing SUD. Social factors: environmental influences, including family dynamics, peer pressure, socioeconomic status, and cultural attitudes towards substance use, play a significant role in the initiation and continuation of substance use. The integration of these factors informs treatment approaches by advocating for multimodal interventions. Effective treatments include pharmacotherapy, Medications such as methadone or buprenorphine for opioid use disorder or naltrexone for alcohol dependence can help manage withdrawal symptoms and cravings. Psychosocial interventions, behavioral therapies, motivational interviewing, and contingency management can address the psychological and social aspects of addiction. Support systems, engaging family members, and social support networks is crucial for promoting recovery and preventing relapse. Relevant guidelines. The Substance Abuse and Mental Health Services Administration (SAMHSA) emphasizes a holistic approach to SUD treatment, recommending integrated services that address medical, psychological, and social needs. Explain the neurobiological changes associated with post-traumatic stress disorder (PTSD) and their implications for treatment. Answer: post-traumatic stress disorder (PTSD) is associated with significant neurobiological changes that affect various brain structures and their functioning. Key alterations include HPA axis dysregulation. Individuals with PTSD often exhibit abnormal levels of cortisol, which can lead to heightened stress responses. Chronic stress can impair the negative feedback loop of the HPA axis, leading to persistent hyperarousal. Amygdala hyperactivity. The amygdala, which is critical for processing fear, often shows increased activation in PTSD, leading to exaggerated fear responses and hypervigilance. Hippocampal atrophy. The hippocampus, involved in memory formation and contextualization of fear responses, is frequently reduced in volume in PTSD patients. This can contribute to intrusive memories and flashbacks. Prefrontal cortex dysfunction. The prefrontal cortex, responsible for regulating emotional responses and inhibitory control, often shows decreased activation, resulting in difficulties in extinguishing fear responses. These neurobiological changes inform treatment strategies for PTSD. Evidence-based therapies include trauma-focused cognitive behavioral therapy (EFBT) helps patients process and reframe traumatic memories. Eye movement desensitization and reprocessing (EMDR) engages patients in bilateral stimulation while recalling traumatic memories, facilitating processing. Pharmacotherapy. Selective serotonin reuptake inhibitors (SRIs) like sertraline and paroxetine are commonly used to alleviate symptoms of PTSD, especially when combined with psychotherapy. Relevant guidelines. The American Psychiatric Association endorses trauma-focused therapies as first-line treatments for PTSD, recognizing their effectiveness in addressing both psychological and biological aspects of the disorder. Mrs. Thompson is a 72-year-old woman who has begun to show signs of memory impairment, difficulty with language, and a decline in her ability to perform daily tasks. After a comprehensive evaluation, she is diagnosed with Alzheimer's disease. What should her care team focus on in terms of treatment and management? Answer: in managing Mrs. Thompson's Alzheimer's disease, her care team should focus on a comprehensive, person-centered approach that encompasses medical, psychological, and social support aspects. Pharmacological interventions. The first line of treatment often involves cholinesterase inhibitors e.g. donepezil rivastigmine to help manage cognitive symptoms by enhancing acetylcholine levels. For moderate to severe Alzheimer's, memantine, an NMDA receptor antagonist, may be introduced to help regulate glutamate activity. Cognitive and behavioral therapies. Engaging Mrs. Thompson in cognitive stimulation therapy (CST) can promote social interaction and cognitive engagement. This includes structured activities that are enjoyable and designed to improve cognitive function. Support and education. Providing educational resources to both Mrs. Thompson and her family is essential for understanding the disease and managing expectations. This may include information about the progression of Alzheimer's and available support services. Advanced care planning. Facilitating discussions about advanced directives, end-of-life preferences, and legal considerations is vital. Encouraging these discussions early can help alleviate stress as her condition progresses. Environmental modifications. Creating a safe and supportive home environment, incorporating visual cues and reminders, and minimizing distractions can significantly enhance her quality of life. Relevant guidelines. The Alzheimer's Association recommends a multidisciplinary approach to care, emphasizing individualized treatment plans that consider the unique needs and preferences of the patient and family. Explain the amyloid cascade hypothesis in the context of Alzheimer's disease and how has this hypothesis influenced treatment approaches? Answer: the amyloid cascade hypothesis is one of the leading theories explaining the pathogenesis of Alzheimer's disease, and it posits that the accumulation of amyloid beta Ab plaques in the brain initiates a series of events that lead to neurodegeneration, eventually resulting in the clinical symptoms of AD, such as memory loss and cognitive decline. According to this hypothesis, E deposition triggers tau protein hyperphosphorylation, neurofibrillary tangle formation, oxidative stress, inflammation, and ultimately neuronal death. This hypothesis has profoundly influenced AD research and treatment development, especially focusing on therapies targeting AB. For example, anti-amyloid drugs. Drugs like aducanumab target Ab plaques in an attempt to slow disease progression. These drugs aim to reduce Ab levels in the brain, potentially delaying or modifying the course of AD. Immunotherapy. Passive and active immunotherapies are designed to stimulate the immune system to clear Ab with the goal of preventing further plaque accumulation. Limitations. While the amyloid cascade hypothesis has driven much of AD drug development, clinical trials targeting AB have yielded mixed results. This has led researchers to consider other factors such as tau pathology, neuroinflammation, and vascular contributions in the disease process. Relevant guidelines. The National Institute on Aging recommends an integrated approach to AD treatment that considers multiple therapeutic targets, including both AB and non-amyloid pathways. Describe the pathophysiology of multiple sclerosis MS and discuss the role of disease-modifying therapies (DMTs) in its management. Answer: multiple sclerosis MS is an autoimmune disorder in which the immune system mistakenly attacks the myelin sheath surrounding neurons in the central nervous system (CNS). This demyelination disrupts electrical signal transmission, resulting in a range of neurological symptoms from fatigue and muscle weakness to cognitive impairment. The disease follows different courses, including relapsing remitting ARMS, secondary progressive MS, SPMS, and primary progressive MS, PPMS. Disease-modifying therapies, DMTs, play a crucial role in MS management by reducing relapse rates. EMTs, such as interferons, glatiramer acetate, and more recently monoclonal antibodies like ocrelizumab, aim to decrease the frequency and severity of relapses in our RMS, slowing disease progression. Certain DMTs have shown efficacy in delaying progression, particularly in RMS and SPMS, by reducing inflammatory activity and protecting against further demyelination. Relevant guidelines. The American Academy of Neurology recommends DMTs a first-line treatment in RMS and certain SPMS cases, with regular MRI follow-ups to monitor disease activity and adjust treatment as needed. What are the key steps in the acute management of ischemic stroke, and how do these interventions improve outcomes? Answer: the acute management of ischemic stroke focuses on restoring blood flow to the brain as quickly as possible to minimize neuronal damage. Key steps include administration of intravenous thrombolytics. Alteplase TPA is the only FDA-approved thrombolytic for acute ischemic stroke, effective if administered within a 3 to 4.5 hour window from symptom onset. TPA dissolves the clot, allowing reperfusion and potentially reducing neurological deficits. Endovascular thrombectomy. For patients with large vessel occlusions, mechanical thrombectomy is recommended within up to 24 hours of onset, especially if they are ineligible for TPA. This procedure involves physically removing the clot via catheter, significantly improving functional outcomes. Supportive care. Stabilizing the patient's vital signs, controlling blood pressure, and preventing complications such as aspiration and deep vein thrombosis are critical. Timely intervention is crucial, as every minute of delay results in significant neuronal loss. Early reperfusion is associated with reduced morbidity and improved long-term recovery. When is epilepsy surgery considered for patients with drug-resistant epilepsy, and what types of surgical options are available? Answer: epilepsy surgery is considered for patients with drug-resistant epilepsy, particularly when seizures persist despite trials of at least 2 anti-seizure medications. Surgical intervention is most effective in cases where seizures originate from a localized, resectable area of the brain, typically in the temporal lobe. Common surgical options include resective surgery, involves removing the epileptogenic focus, e.g. temporal lobectomy. This approach can be curative in carefully selected cases. Corpus callosotomy, used mainly in patients with generalized seizures to limit the spread of seizure activity between hemispheres. Vagus nerve stimulation, VNS, an option for patients not eligible for resective surgery. VNS involves implanting a device that sends regular electrical pulses to the vagus nerve, reducing seizure frequency in some patients. Responsive neurostimulation, RNA, This involves an implantable device that monitors brain activity and delivers electrical stimulation when seizure patterns are detected. Explain the standard treatment protocol for glioblastoma and the challenges associated with its management. Answer: glioblastoma GBM is the most aggressive primary brain tumor with a median survival of about 1 to 18 months despite treatment. The standard treatment protocol for GBM, often referred to as the STUP protocol, includes surgical resection. Maximum safe resection is performed to reduce tumor burden while preserving neurological function. Radiation therapy and temozolomide (TMZ). Post-surgical radiation combined with the chemotherapeutic agent TMZ is the mainstay of treatment, aiming to target residual tumor cells. TMZ is administered both during and after radiotherapy adjuvant phase for up to 6 months. Tumor treating fields (TT fields), a newer therapy that delivers low-intensity electrical fields to the tumor area, disrupting cell division. TTA fields has shown promise in extending survival in conjunction with TMZ. Challenges in management. GBM is highly invasive, with tumor cells infiltrating surrounding brain tissue, making complete resection impossible. Additional GBM's resistance to conventional therapies and the blood-brain barrier limits effective drug delivery, contributing to its poor prognosis. What are the mechanisms of action for SSRIs, selective serotonin reuptake inhibitors, and how do they differ from SNRIs, serotonin norepinephrine reuptake inhibitors, in the treatment of depression? Answer: SSRIs primarily work by blocking the reuptake of serotonin in the brain, thereby increasing its availability in the synaptic cleft. This mechanism is thought to enhance mood and alleviate depressive symptoms. Common SSRIs include fluoxetine, sertraline, and escitalopram. In contrast, NRIs such as venlafaxine and duloxetine inhibit the reuptake of both serotonin and norepinephrine. This dual action can provide broader therapeutic effects, particularly in patients who exhibit not only depressive symptoms but also chronic pain, as norepinephrine plays a crucial role in pain modulation. The choice between SSRIs and SNRIs may depend on individual patient factors, including side effect profiles, co-occurring conditions, and previous treatment responses. Clinicians should be aware of the potential for side effects such as sexual dysfunction with SSRIs and increased blood pressure with higher doses of NRIs. Relevant guidelines. According to the American Psychiatric Association's APA guidelines for the treatment of major depressive disorder, SSRIs are often first-line treatments due to their safety and efficacy profile, while SNRIs are considered for patients who do not respond adequately to SSRIs or have additional symptoms like pain. Discuss the implications of pharmacogenomics in tailoring psychiatric treatment. How does the understanding of CYP enzyme variations enhance personalized medicine in psychiatry? Answer: pharmacogenomics studies how genes affect a person's response to drugs, aiming to tailor medication choices based on individual genetic profiles. Variations in cytochrome P, CYP enzymes, particularly CYP and CYP, can significantly impact the metabolism of many psychiatric medications, including antidepressants and antipsychotics. For instance, individuals with certain CYP gene polymorphisms may be classified as poor metabolizers, leading to increased drug levels and heightened risk of side effects or toxicity when standard dosages are prescribed. Conversely, ultra-rapid metabolizers may experience subtherapeutic effects due to the rapid breakdown of medications. This understanding allows clinicians to predict optimal drug choices and dosages, enhancing treatment efficacy and safety. A personalized approach not only improves patient outcomes but also minimizes the trial and error process often associated with finding the right psychiatric medication. Relevant guidelines. The Clinical Pharmacogenetics Implementation Consortium (CPIC) provides guidelines on the use of pharmacogenomic testing to inform antidepressant prescribing, recommending specific drug choices based on genotyping results to improve therapeutic outcomes. Compare and contrast the goals and techniques used in cognitive behavioral therapy (CBT) and dialectical behavior therapy (DBT) for treating borderline personality disorder. Answer: CBT focuses on identifying and modifying dysfunctional thought patterns and behaviors that contribute to emotional distress. Its goal is to develop coping strategies that foster positive changes in behavior and emotional regulation. Techniques include cognitive restructuring, exposure therapy, and behavioral activation. DBT, on the other hand, was specifically designed for individuals with borderline personality disorder and emphasizes the balance between acceptance and change. It incorporates mindfulness practices to help clients tolerate distress and manage emotional regulation. DBT also includes skills training in interpersonal effectiveness, emotion regulation, distress tolerance, and acceptance, fostering a holistic approach to treatment. While both therapies aim to reduce symptoms and improve functioning, CBT primarily targets cognitive distortions, whereas DBT focuses on enhancing emotional and interpersonal skills while validating the client's experiences. Relevant guidelines. The APA endorses CBT as an evidence-based treatment for various disorders, while DBT has strong empirical support for its effectiveness in reducing self-harm and improving emotional regulation in borderline personality disorder. Mrs. Anderson, a 35-year-old patient with a history of major depressive disorder, presents with worsening symptoms despite being on fluoxetine for the past 6 months. She expresses frustration about her treatment and is considering discontinuing her medication. What steps should her psychiatrist take to address Mrs. Anderson's concerns and optimize her treatment plan? Answer: the psychiatrist should first conduct a thorough assessment to understand the reasons for Mrs. Anderson's dissatisfaction with her treatment. This could involve exploring her medication adherence, potential side effects, and any recent life stresses that may have contributed to her symptoms. Next, the psychiatrist should educate Mrs. Anderson on the importance of continuity in treatment and the potential timeline for medication efficacy, as SSRIs may take several weeks to demonstrate full effect. Discussing alternative options, including augmenting a current treatment with psychotherapy, such as CBT, or considering an SNRI or other antidepressants may also be beneficial. If there are concerns about the current medication's effectiveness, the psychiatrist could also consider switching to a different SSRI or augmenting with an adjunctive medication like bupropion. Engaging in a collaborative decision-making process where Mrs. Anderson's preferences and concerns are prioritized will help enhance her treatment adherence and overall satisfaction. How do cultural factors influence the expression and diagnosis of psychiatric disorders? Provide examples of cultural variations in mental health symptoms. Answer: cultural factors profoundly influence how individuals express and interpret psychiatric symptoms. For example, in some cultures, emotional distress may be manifested through somatic complaints rather than psychological symptoms, a phenomenon known as somatization. In cultures where mental illness carries stigma, individuals may be reluctant to report symptoms related to anxiety or depression, instead describing them in physical terms. Additionally, cultural beliefs may shape how psychiatric disorders are diagnosed. For instance, the concept of ataque nerviosa, common in Latino cultures, may encompass symptoms such as intense emotional distress, tremors, and crying, which may not fit neatly into Western diagnostic categories, but are culturally valid expressions of distress. Culturally competent clinicians must be aware of these variations to avoid misdiagnosis and to provide effective, culturally sensitive care. This involves adapting assessment techniques to consider cultural expressions of distress and engaging in open dialogue about cultural beliefs surrounding mental health. Relevant guidelines. The DSM-5 includes cultural concepts of distress to help clinicians recognize and assess cultural variations in symptom presentation and improve diagnostic accuracy. Discuss the clinical indications for electroconvulsive therapy ECT and the rationale for its use in treatment-resistant depression. Answer: CT is a highly effective treatment for severe treatment-resistant depression, especially in cases where rapid response is crucial, such as in patients presenting with suicidal ideation or those who cannot tolerate antidepressants due to severe side effects. The CT is also indicated for psychotic disorders and severe mania. The rationale for a CT includes its ability to induce rapid neurochemical changes that lead to mood stabilization, often more quickly than pharmacotherapy. Mechanistically, a CT is thought to alter neurotransmitter systems and promote neuroplasticity, contributing to its therapeutic effects. The CT is generally considered when patients have not responded to at least 2 adequate trials of antidepressant medications or when their condition poses an immediate risk. It is essential for clinicians to provide informed consent and discuss potential side effects, such as transient memory loss, which can occur with treatment. Relevant guidelines. The APA endorses the CT as a safe and effective treatment for severe depression, emphasizing its role when rapid intervention is necessary or when other treatments have failed. Evaluate the role of family therapy in the treatment of adolescent depression. What are the core principles guiding this therapeutic approach? Answer: family therapy plays a crucial role in the treatment of adolescent depression by addressing relational dynamics and communication patterns within the family system. Core principles of this approach include collaboration with family members to identify issues contributing to the adolescent's depression, fostering understanding and support within the family, and promoting healthier interactions. Therapists work to empower families by enhancing their problem-solving skills, improving emotional expression, and strengthening support networks. Engaging the family is particularly important, as adolescents are significantly influenced by their familial environment. Family therapy also seeks to alleviate stresses that may exacerbate the adolescent symptoms, such as conflicts or misunderstandings among family members. Research indicates that involving families in treatment can lead to better outcomes for adolescents, including reduced depressive symptoms and improved functioning. Clinicians should consider the family's role in the adolescent's life and the potential benefits of a systemic approach. Mr. Thompson, a 42-year-old man diagnosed with bipolar disorder, is experiencing a manic episode characterized by impulsive spending and elevated mood. His partner expresses concern about the impact of his behavior on their financial stability. What strategies should his psychiatrist implement to manage Mr. Thompson's current episode while considering his partner's concerns? Answer: the psychiatrist should initiate a comprehensive assessment to evaluate the severity of Mr. Thompson's manic symptoms, including potential triggers and the extent of impairment in functioning. Collaborative decision-making involving Mr. Thompson and his partner can be beneficial in developing an effective management plan. Immediate strategies may include the adjustment of his medication regimen, potentially increasing the dose of mood stabilizers like lithium, or considering the addition of atypical antipsychotics to mitigate manic symptoms. Psychoeducation for both Mr. Thompson and his partner is critical, as it will help them understand the nature of bipolar disorder, the importance of medication adherence, and the signs of impending mood episodes. Additionally, implementing harm reduction strategies such as setting financial limits or establishing a joint account for essential expenses can help safeguard the couple's financial stability during this period. Regular follow-ups are essential to monitor progress and make further adjustments as needed. Relevant guidelines. The APA recommends a biopsychosocial approach to treating bipolar disorder, emphasizing the importance of medication management combined with psychoeducation and family involvement. In what ways does cultural stigma affect help-seeking behavior among individuals with mental health disorders? Provide an analysis of the potential barriers that may arise. Answer: cultural stigma significantly influences help-seeking behavior, often leading individuals to avoid seeking treatment for mental health disorders due to fear of judgment or discrimination. In cultures where mental illness is viewed negatively, individuals may experience shame, which can deter them from accessing necessary care. Barriers stemming from stigma may include a lack of awareness about mental health conditions, misunderstanding of treatment processes, and the perception that mental health issues are a sign of weakness. Additionally, individuals may worry about confidentiality breaches or potential repercussions in their social or professional lives. Overcoming these barriers requires culturally sensitive interventions that promote awareness and education about mental health, normalize help-seeking behaviors, and provide community support systems. Engaging community leaders and utilizing culturally relevant messaging can also reduce stigma and encourage individuals to seek treatment. Relevant guidelines. The World Health Organization, who emphasizes the need for anti-stigma campaigns as part of comprehensive mental health strategies, advocating for improved public understanding and acceptance of mental health issues. Analyze the efficacy of interpersonal therapy for treating major depressive disorder. What are its foundational principles and how do they contribute to the treatment process? Answer: interpersonal therapy is an evidence-based treatment specifically designed to address interpersonal issues that contribute to depressive symptoms. Its foundational principles include the recognition that interpersonal relationships significantly impact mood and that improving these relationships can facilitate recovery from depression. IPT focuses on 4 key areas: unresolved grief, role disputes, role transitions, and interpersonal deficits. By identifying and addressing these areas, therapists help clients develop more effective communication skills, enhance their social support networks, and resolve conflicts that may be contributing to their depressive state. Research indicates that IPT can be as effective as antidepressant medications for treating major depressive disorder, particularly in cases where interpersonal relationships are central to the client's distress. The collaborative nature of IPT encourages clients to engage actively in their treatment, fostering a sense of agency and empowerment. Relevant guidelines. The APA supports IPT as a recommended treatment for depression, emphasizing its efficacy in enhancing interpersonal functioning and reducing depressive symptoms through structured therapeutic techniques. Discuss the role of neuroplasticity in the recovery from brain injury. How does synaptogenesis contribute to this process? Answer: neuroplasticity refers to the brain's ability to adapt and reorganize itself by forming new neural connections throughout life. In the context of recovery from brain injury, neuroplasticity allows unaffected regions of the brain to take over functions previously managed by damaged areas. Synaptogenesis is a key mechanism of neuroplasticity involving the formation of new synapses between neurons. Following a brain injury, there is often a period of inactivity in certain neuronal pathways, which can lead to the loss of synapses. However, the brain can respond by generating new synaptic connections, especially through rehabilitation therapies. Research shows that intensive rehabilitation encourages the production of neurotrophic factors, which promote synaptic growth and enhance plasticity. For example, the release of brain-derived neurotrophic factor (BNF) plays a crucial role in synaptogenesis and overall brain health. Understanding these processes is vital for developing effective therapeutic strategies post-injury. Explain the neuropsychiatric implications of thyroid dysfunction. What are the specific psychiatric symptoms associated with hyperthyroidism and hypothyroidism? Answer: thyroid dysfunction significantly impacts mental health, with both hypothyroidism and hypothyroidism associated with distinct psychiatric symptoms. Hypothyroidism, characterized by excessive thyroid hormone production, patients often present with anxiety, irritability, mood swings, and symptoms resembling panic attacks. Increased metabolic rate may lead to heightened energy levels and restlessness, potentially mimicking or exacerbating anxiety disorders. Hypothyroidism. Conversely, this condition marked by insufficient thyroid hormone can lead to depressive symptoms, lethargy, cognitive impairment, and slowed thinking. Bradophrenia. Patients may experience a lack of motivation and apathy, often leading to misdiagnosis as major depressive disorder. Understanding these associations is critical for clinicians, as treatment of the underlying thyroid disorder often alleviates psychiatric symptoms. Clinicians should routinely screen patients presenting with mood disorders for thyroid function abnormalities. A 42-year-old patient named Mr. Thompson has recently been diagnosed with Cushing's syndrome. He reports mood swings, irritability, and difficulty concentrating. What should Mr. Thompson's psychiatrist consider in managing his psychiatric symptoms in relation to his endocrine disorder? Answer: Mr. Thompson's psychiatrist should consider the following steps in managing his psychiatric symptoms related to Cushing's syndrome. Comprehensive assessment. Evaluate the severity of the psychiatric symptoms and their impact on Mr. Thompson's daily functioning. Collaborative care. Coordinate with an endocrinologist to ensure that Mr. Thompson's Cushing's syndrome is adequately managed. Treatment options may include surgical intervention, medication, or radiation therapy to address the underlying cause of excessive cortisol production. Psychiatric interventions. Consider psychotherapy tailored to the patient's needs, which could include cognitive behavioral therapy (CBT) to address maladaptive thought patterns exacerbated by mood instability. Medication management. Depending on the psychiatric symptom severity, short-term pharmacotherapy with SSIs or mood stabilizers may be warranted. Patient education. Educate Mr. Thompson about the connection between his endocrine disorder and psychiatric symptoms, emphasizing that effective treatment of Cushing's can significantly improve his mental health outcomes. Describe the role of neuroimaging techniques in understanding the pathology of schizophrenia. Which specific imaging modalities are most useful? Answer: neuroimaging techniques play a crucial role in elucidating the structural and functional abnormalities associated with schizophrenia. They provide insights into the pathophysiology of the disorder, which is characterized by complex interactions among genetic, neurodevelopmental, and environmental factors. Structural MRI. This modality is valuable for assessing brain morphology. Studies have shown that patients with schizophrenia may exhibit reduced volume in key areas such as the prefrontal cortex and hippocampus. Additionally, abnormalities in the lateral and third ventricles are commonly observed. Functional MRI-FRI. This technique assesses brain activity by measuring changes in blood flow. FRI studies have identified altered connectivity patterns in schizophrenia, particularly during tasks requiring cognitive effort or emotional processing, highlighting dysfunction in the default mode network and executive function circuits. Positron emission tomography (PET) imaging allows for the assessment of neurotransmitter systems, particularly dopaminergic pathways. Elevated dopamine synthesis and release in the striatum have been consistently linked to psychotic symptoms. Analyze the impact of metabolic disorders on neuropsychiatric health. How can electrolyte imbalances specifically affect mental status? Answer: metabolic disorders can have profound effects on neuropsychiatric health due to their influence on homeostasis and neurotransmitter function. Electrolyte imbalances, specifically conditions such as hyponatremia, low sodium, and hypocalcemia, high calcium, can severely affect mental status. For example, hyponatremia can lead to confusion, seizures, and alter mental status due to cerebral edema, while hypocalcemia may cause lethargy, cognitive impairment, and even psychosis. The mechanisms behind these effects often involve disruptions in neuronal excitability and synaptic transmission. The brain's reliance on precise ionic balances means that any significant alteration can result in considerable functional impairment. Clinical management should include correcting the underlying electrolyte imbalance while closely monitoring the patient's neurological status. Rehydration, electrolyte replacement, and in severe cases, hospitalization may be necessary. How do genetic and environmental factors interplay in the development of neuropsychiatric disorders? Discuss the implications for treatment and prevention. Answer: the interplay between genetic and environmental factors is fundamental in the development of neuropsychiatric disorders, reflecting the biopsychosocial model of mental health. Genetic factors. Heritability studies indicate that many disorders, such as schizophrenia and bipolar disorder, have significant genetic components. Specific genes have been implicated in neurotransmitter systems, e.g., dopaminergic and serotonergic pathways, which can influence susceptibility to these disorders. Environmental factors. Factors such as prenatal stress, exposure to toxins, and psychosocial stressors can interact with genetic predispositions to trigger or exacerbate neuropsychiatric disorders. Treatment implications. Understanding the gene-environment interplay can inform personalized treatment approaches. For instance, identifying genetic markers may help predict responses to certain medications while addressing environmental factors, e.g., stress management. Improving social support is crucial for comprehensive treatment. Prevention strategies. Preventive measures should focus on mitigating environmental risks, particularly in high-risk populations. Explain how developmental neurobiology contributes to understanding autism spectrum disorders. Asked, what are the key developmental milestones associated with ASD? Answer: developmental neurobiology provides critical insights into the etiology and manifestation of autism spectrum disorders, as research indicates that abnormalities in brain development during key milestones can lead to the characteristic behaviors and challenges associated with ASD. Brain growth patterns. Studies show atypical brain growth trajectories in infants and young children with ASD. Initially, children may experience accelerated brain growth followed by a plateau or reduced growth, particularly in areas associated with social communication and behavior regulation. Synaptic development. During early development, the processes of synaptogenesis, formation of synapses, and pruning, elimination of excess synapses are crucial. In ASD, there may be alterations in these processes, leading to either excessive synapses or dysfunctional connectivity among neural circuits, particularly in the prefrontal cortex and limbic system. Key milestones. Developmental milestones that may indicate risk for ASD include delayed speech and language skills, lack of joint attention, and limited social interaction by 12 to 24 months. Discuss the significance of neurogenetics in the diagnosis and treatment of psychiatric disorders. How can genetic testing inform clinical practice? Answer: neurogenetics, the study of how genes influence brain function and behavior, plays a vital role in the diagnosis and treatment of psychiatric disorders. Diagnosis. Genetic testing can identify specific genetic variants associated with various psychiatric disorders such as schizophrenia and major depressive disorder. For example, copy number variations, CNVS, have been linked to increased risk for schizophrenia, allowing for more precise diagnosis and risk assessment. Pharmacogenomics. One of the most promising applications of neurogenetics is pharmacogenomic testing, which examines how genetic variations affect individual responses to medications. Variants in genes related to drug metabolism, e.g., CYP enzymes, can inform clinicians about potential efficacy and risk of side effects, leading to personalized medication strategies. Ethical considerations. While neurogenetics holds promise, ethical concerns regarding genetic privacy, potential stigma, and the implications of test results for patients and families must be considered. Clinicians should engage in discussions about the benefits and limitations of genetic testing with patients to ensure informed decision-making. Analyze the neuropsychiatric implications of vitamin deficiencies, particularly focusing on vitamin B and folate. What are the potential consequences of these deficiencies on mental health? Answer: vitamin deficiencies, particularly B and folate, have significant neuropsychiatric implications due to their roles in neurotransmitter synthesis and overall brain health. Vitamin B deficiency. This deficiency can lead to neurological and psychiatric symptoms, including cognitive decline, mood disturbances, and even psychosis. The mechanisms involve impaired myelin synthesis and neuronal integrity, as B is essential for myelination and DNA synthesis in neuronal cells. Clinically, patients may present with peripheral neuropathy, memory problems, and depressive symptoms. Folate deficiency. Folate plays a crucial role in methylation processes and the synthesis of neurotransmitters like serotonin and dopamine. Deficiency has been associated with increased risk of depression and may worsen symptoms in individuals with pre-existing mood disorders. Additionally, low folate levels during pregnancy are linked to neurodevelopmental issues in offspring. Management. Addressing these deficiencies through dietary modifications or supplementation can lead to significant improvements in mental health outcomes. Clinicians should routinely assess nutritional status, especially in populations at risk for deficiencies, such as the elderly or individuals with malabsorption syndromes. Evaluate the impact of systemic disorders, such as autoimmune diseases, on neuropsychiatric health. How can these conditions manifest neurologically? Answer. Systemic disorders, including autoimmune diseases, can profoundly affect neuropsychiatric health through various mechanisms, including inflammation, autoantibody production, and metabolic dysregulation. Inflammation. Autoimmune diseases like lupus and multiple sclerosis can cause systemic inflammation that affects the central nervous system (CNS). Cytokines released during inflammatory responses can disrupt neurotransmitter systems and lead to mood disorders, cognitive impairment, and psychosis. Neuropsychiatric manifestations. Patients with systemic lupus erythematosus, SLE, may experience cognitive dysfunction, mood disturbances, and even seizures due to neuropsychiatric lupus. Similarly, multiple sclerosis may present with depression, anxiety, and cognitive decline as a direct result of demyelination and neural injury. Clinical implications. For clinicians, understanding the relationship between systemic disorders and neuropsychiatric symptoms is crucial for comprehensive patient management. Early recognition of neuropsychiatric manifestations can lead to prompt treatment of the underlying autoimmune condition, potentially improving both physical and mental health outcomes.